you describe this quite acutely as the worst moment of the pandemic. And why do you say that? Why do you describe it in those terms?
It was very frustrating for us to have been asked to advise the government and to advise the government that the autumn would be difficult and that that difficulty would manifest as rising numbers of infections. And then we had this astonishingly good ability to watch that happening with the ONS COVID infection study, and it just proceeded to happen. So we said, you should do something now, but nothing happened.
Do you recall the earliest point at which you said you should do something?
Let's have a think. We had made in the summer, we had made the new reasonable worst case. So that was the one that sort of ran from, I should think, about August into late autumn. And in the reasonable worst case, which, as I say, was based on actions specified by COVID-S, cases start to tick up in early September, as we would always have expected to have done. And I can't remember where the words came from, but in the reasonable worst case, somebody gets a grip. So actually what happens is that cases are then flat through September. So it would have been in our minds all along that if we wanted this time to keep infections flat whilst they were still low, so not get ourselves into a panicky situation where it's all running away from us, this was when we needed to do it. And that, you know, this idea that the interventions that keep an epidemic flat are not as bad, not as damaging as the ones that you have to impose if you've got to get cases down really fast. So that was the time to act, we felt, and we kept saying so. And I suppose we couldn't understand why weren't we explaining clearly enough that this was what we needed to do.